Hi viewers, friends. Hi, I'm Dr. Thomas once again from Nechupadam Dental at Marine Drive, Cochin. It's part of Kerala, those who don't know. But I'm coming with a lot of videos on dentistry. Some are in Malayalam, some are in English. So some of the English videos can be seen on the YouTube. Please subscribe me and please let me know what you think about it, or if you want a topic to be covered, please let me know. Now, today I'm going to talk brief about if you lose one tooth, what happens. See, if you lose one tooth, most of the people think that okay, it's just one tooth. Yes, if it is a wisdom tooth which is nasally inclined, or tooth which is malpositioned in the back of the mouth, which is a wisdom tooth, or the last tooth which is there, it doesn't matter much. But most of the time, if you remove one tooth which is in a row, then you start with the dental problems then and there itself. The first problem is most of the time you will not be able to brush that area very well because you have removed the teeth. Why? Because the tooth next to it will move into that space in a few days. So what happens? Food gets in between those two teeth, and then that food cannot be removed effectively. You might say that okay, we have flossing. Yes, you have flossing, but still the flossing doesn't remove the finer parts of the food, and even the floss can get in between the gums and get into trouble. So that is the first thing. Second thing is, you will not be chewing on that area because you are comfortable with the side which is having all the teeth, because you will be able to chew much better. So that will cause one problem on that side. That is because you are using it too often and too much. That area will start grinding much more. And second thing is, your muscles on that area, if it is removed from this side, if the tooth is removed from this side, the other side, the muscles will become stronger and stronger. You know that if you work out well, you will get much more vessels, so that area muscles will be much more stronger. And this side, which is not used, which is actually a tooth which is removed, you will not use it, so you might get the muscles weaker and weaker. So after a while you might get a face which is a little more plumper on the other side. So this is one issue. So I have come to the second one. The third one is basically, if you lose one tooth in the back especially, you mostly will get the opposing tooth. If it is the lower which is removed, the upper tooth can come into that place, because it comes and it tilts itself and comes into that space, and that will cause, if it is a lower tooth, and that will cause a food getting in between the upper teeth also. See, if you get food getting in with the teeth, then you might have a problem with caries also, because food gets in between, stays there, get decomposed, causes acids, and then get into caries also. So if you lose a tooth, what to do? Doctor, I have lost the tooth some years back, I have all these problems. Please make sure that you replace that tooth and close the spaces next to that. So how do you replace the tooth? You can use a bridge. There is a lot of hangama saying that bridges are not good and all those things, but bridges have worked for 30-40 years in my dental clinic practice, because this is started by dad, and even in my practice for the last 20 years we have used extensively bridges. It works. But you have options of implant also. Implant also works, provided you keep it clean and meticulously maintained. Implants are really good. So implants also, whatever said and done, please make sure that you replace the tooth which is lost, so that we can able to chew well, you are able to smile well, and your proportions of your face is kept well. And last but not the least, if you have all the teeth in your mouth, you'll be able to chew well, and that will help you in digestion. That will help you in keeping your body also very fit. So make sure that you don't remove the tooth if it is possible. If it is removed, please make sure that it is replaced as early as possible, so that you'll be able to chew and use that area really well. So make sure that you are using your teeth to the best of possibilities, so that your body is maintained, your health is maintained, your oral health is maintained, and make sure that you don't have spaces between the teeth, so that those teeth also will be kept really well. Have a great day and a great smile. Bye bye.